It's Great Day Houston. From food, fun, health, family, in other words, your life. It's your morning wake-up call to everything Houston. And here's your host, Deborah Duncan.
We've been talking a lot about treatment for various cancers, but our next guest wants to focus on a form of possible prevention. Please welcome Dr. Stephen Hotze from the Hotze Health and Wellness Center. Hello there.
Good morning.
I mentioned before the break, we know lots of things that can add to a person's risk of getting cancer, but one thing that we don't hear a lot about is hormone imbalance.
Well, that's very important because it's usually, in most cases, excess estrogen that is related directly or indirectly to the cancer of the breast.
Yeah, because hormones play a obviously critical role in the body. We wouldn't be alive without hormones in the body.
Well, it's really key. The two key hormones that women make, their two key sex hormones, are estrogen hormones and progesterone. Estrogen is a proliferative hormone. It stimulates breast tissue production, and progesterone inhibits it, so it has to balance out like on a seesaw. As women mature, oftentimes and always their progesterone levels decline. That means estrogen becomes the dominant hormone. It causes overstimulation of the breast.
This is when we hear people say estrogen dominance.
Right, this is estrogen dominance, and they know that because they start getting breast tenderness, fluid retention, weight gain, mood swings, headaches premenstrually. This is a sign of estrogen dominance, and when that occurs, that's when breast cancer starts to occur between the ages of 35 and 55. We see the upswing, and that's when progesterone levels fall. And there was a study done in 1981 by the American Journal of Epidemiology that showed that women that had progesterone deficiency, that's the hormone of the last half of the month, had a 540% increase in breast cancer and a 1,000% increase of cancers of all types. So progesterone is a preventative hormone. It's the hormone of pregnancy, and we know that women that have the most babies, they have the most progesterone, they have the lowest risk of breast cancer. And we know that women that take counterfeit hormones or birth control pills that suppress the production of progesterone have the highest incidence of breast cancer. So progesterone is a protective hormone that really all women ought to be supplementing in adequate amounts as they mature and walk through their menstrual life.
Okay, you mentioned some of those symptoms. You have a test in your book, Hormones, Health, and Happiness, which, by the way, the entire audience is getting a copy of Dr. Hotze's book. You have a series of questions, and so we went through a number of those questions. You talked about, the premenstrual breast tenderness, premenstrual mood swings, fluid retention, weight gain, menstrual cramps, irregular menstrual cycles. That sounds like an average moment once a month for, for a lot of people.
And it is.
Yeah.
But it's a sign that you have an imbalance between your progesterone and estrogen. If you have enough progesterone in the last half of the month, you can sail through that without any of those symptoms.
Okay, so we talked to a couple of the people that were top scorers on this test here, and so we have some folks who have some questions for you, ma'am.
My question is does age affect it? Because I noticed when I was younger I didn't have those symptoms, and as I got older, I'm in my 40s now, I'm having those symptoms.
This point well taken. If everything's right in a perfect world, when you're younger, you balance your hormones out, the estrogen and progesterone. As you age, progesterone levels fall, estrogen becomes the dominant hormone, and you start developing those symptoms, premenstrual symptoms, and you get irregular periods, heavier periods, bleeding, cramping, intermenstrual bleeding, all fibroids, and all these things are a sign of estrogen dominance and progesterone deficiency. That's when women need to supplement and replenish their declining progesterone, not at menopause, but back when they start having the symptoms, which can happen in their 20s or early 30s.
All right, what we call perimenopause in a sense?
Well, those aren't really perimenopausal. Those are they're premenstrual symptoms, and they're a sign of low progesterone, and they get worse as you move towards your change of life. They get much worse.
Okay, ma'am.
Are there certain foods that you can avoid to help reduce the risk of estrogen dominance?
Well, there are foods that you can eat that would promote good, healthy eating habits that would help prevent cancer. We know this, is that being overweight increases your risk of all type of cancers. Particularly breast cancer can be promoted because when we're overweight, we have too many fat cells. Fat cells make estrogen. They lead to estrogen dominance. So you want to have a diet that would, or an eating program that would be high in vegetables and fruits so you can maintain a good body weight, and you'd eliminate those foods that have are packaged foods that have all the dyes and chemicals and the things that can promote cancer.
And a lot of this stuff is explained in your book. This is kind of like this great resource to have that I keep referring to as I keep aging. I keep going back and going, oh, that's me now. But it really explains it well, and the important role of hormones and the symptoms, so you can kind of correlate those things and keep track of what's happening with your body. For more information about the Hotze Health and Wellness Center, you can log on to hotzehwc.com or call 281-698-8698, 281-698-8698. You can also catch Dr. Hotze on the radio. His program, Health and Wellness Solutions, airs Monday through Friday at noon on KSEV Radio 700 AM, or listen live on the web, hotzehwc.com. And also, if you are in menopause, he can help you get through it and keep your sanity and your family's sanity as well. After the break, a cutting-edge breast cancer procedure that's helping women look and feel natural again after their breasts have been removed.
The recent wildfires burned